Welcome back to the channel. Today we are going to fix your shoulder, and we're going to do that with an exercise that I'm going to teach you called the Axillary Nerve Glide. Now, a very common complaint when it comes to shoulder problems is having pain or discomfort when you raise your arm out to the side. So let's say you're holding a dumbbell and you raise that dumbbell out to the side, right? This is called a lateral raise. Oftentimes people complain of having pain around the deltoid region, or when they're doing more exercises that require rotation of the shoulder. So maybe you feel it during your exercise, or maybe your shoulder problem comes up during your day when you're going about your daily activities and you raise your arm out to the side and you feel that pain in that shoulder area. If this sounds like you, make sure you watch this entire video, because the exercise that I'm going to show you is incredibly high percentage for dealing with issues like I just described. Are you ready? Let's get into it. Before I get into the actual demonstration of the exercise, let me tell you a little bit about the axillary nerve. It's a peripheral nerve, and it originates in the cervical spine. That's your neck. And this is at the C5 and the C6 level. The axillary nerve is both a sensory and a motor nerve. So that means that it supplies both the skin, so there's a patch of skin in this area that the nerve supplies, and also some muscles. The deltoid muscle, right, that big shoulder muscle, and also the teres minor muscle, part of the rotator cuff that allows us to outwardly rotate our shoulder. All right, so we have arrived at step number 1, and this is the most important step that I'm going to cover with you. This is all about the assessment process. The number one complaint that I always hear from people when they're looking for different exercises and therapeutic interventions to help them with different pain issues is that they're never really sure if an exercise or a therapy is helping them the way that they are hoping for, because they don't have an assessment process. So if you don't know how you're responding to an exercise that you're trying, it's going to be very confusing for you. You're not going to have a lot of confidence that the exercise is going to help you, and therefore you won't invest your time and effort into practicing it. And if you don't practice it, well, then you just don't get the results. So this is the most critical thing for you to take away from this video. We need to assess your shoulder function both before the exercise that we're going to work with and immediately after. So this is a form of an immediate feedback type of assessment process. So what I'm saying is we're going to test in the moment how your brain and body is responding to the exercise, not 12 weeks from now. So very typically people will think about assessing their shoulder function now and then maybe 12 weeks from now to see how things are working. No, that's not what I'm talking about. That is a very frustrating process. What I actually want to know is the exercise helping you right now? And so we have a way to determine that. This is our immediate feedback assessment process. Super simple. Just test your shoulder, the shoulder that's bothering you. So if it's bothering you with a shoulder lateral raise, you might be able to put some light weight in your hand and try out some lateral raises. If the weight is too heavy for you and you're having pain, then certainly don't push into a painful range of motion. You might be able to just kind of test that movement very gently. We don't want to push the range of motion and exacerbate any issues that you're having. Just go really easy with this and get a sense for how your shoulder feels in the moment. So perhaps these lateral raises will tell you that. Maybe you can do some rotation-based movements, right? You could simply test some shoulder internal and external rotation. Okay, and when you're doing this, whatever it might be, shoulder abduction, flexion, really anything for your shoulder, okay, is going to be good. When you're doing this, take some mental notes. How does it feel when you're producing the movement? Is there any limiting factors? And also, how far are you going, right? If you choose to do like a shoulder abduction, right, get a sense for how far you're going right? And how it feels. So then when we assess after performing the exercise, you really understand where you are in the moment, and you'll be able to determine whether or not you get better, stay the same, or potentially even get worse. And yes, it's possible that you could get worse. Here's the truth that basically nobody ever talks about. Everybody responds differently to exercise. Okay, so even though this axillary nerve glide happens to be incredibly high percentage for helping people with their shoulder issues, it doesn't mean that it's going to be the perfect exercise for you. And this is why we have to assess your shoulder function, because if you just take my word for it, do the exercise, and then decide, okay, I'm going to be super committed to this and go do it for the next 3 weeks, if it happens to be assessing poorly for you, and reducing your range of motion or potentially increasing your pain, you are now effectively practicing what we call a threatening exercise over and over and over again, which doesn't make any sense because it's regressing you. So what we're looking for is a high payoff result. And that means that in the moment, after performing the exercise, you would notice maybe a change in range of motion. Okay, so you could lift your arm higher. And if you've had any pain reduction, you might notice, oh, okay, my pain went from, it was a 5 out of 10 starting, and now I've done 1 or 2 sets of the exercise, and now I think it's about a 3 out of 10. That would be good. So we're looking for a high payoff result. And it's really important that you know how your brain and your body is responding to the exercise so that you know whether or not it's worth practicing. So there's 3 different possibilities. You're either going to get better or stay the same, meaning it could be useful if you practice it a little bit more. Maybe you haven't hit the target perfectly yet, and in a couple more tries and you might start to see some changes. But if it continues to be kind of the same result, then maybe it's just not the exercise for you. Maybe it's not the right stimulus. And then last, if you get worse and maybe you try it again and you notice, yeah, I'm regressing, this isn't the exercise for me, well then you have to keep hunting for the right exercise for you. But remember, you can still use the assessment process that I'm teaching you right now to understand whether any exercise is helping you or potentially hindering your progress. So let's go hunting for that high payoff exercise and get started with the axillary nerve glide. All right, so you have your baseline assessment for your shoulder, both through means of testing range of motion, right? But also maybe the discomfort that you're feeling. So you can mark that on a scale, all right? If you have some discomfort right now, mark it on a scale of 1 to 10 so that you can go back and use that pain scale to help you determine whether or not this exercise is a good exercise for you. So getting into the exercise now, what we're gonna do, and I'm gonna show you kind of a 45-degree angle to start. What you're going to do is take the target arm that we're going to be working on, and you're just going to partially bend your arm at the elbow and then rotate your arm inward. And this is just comfortable range of motion. There's no reason to force the range of motion. Just comfortably bend your elbow, rotate it in. Okay? Now, think about your shoulder, not just like the ball and socket part of the shoulder, but also your shoulder blade, right, on the back of your rib cage. And I want you to draw your shoulder blade and shoulder down towards the ground. From here, watch this little movement. This is very subtle. Take your whole arm and pull it back. Okay, so now we are in the tensioning position for the axillary nerve glide as far as the arm goes. And some of you might already feel a gentle stretching sensation in the shoulder area. And it should be very gentle, kind of radiating in nature, not necessarily specifically targeting like an exact part of a muscle, but when we put tension, gentle tension on nerves, we kind of feel it in a broad area and it feels very radiating. So it's different from how you might feel like a traditional stretch of a muscle. So once we're in this position, those of you who feel tension about a 3 out of 10 in intensity, right, in terms of the stretch sensation, you can stop here. But if you don't yet have a 3 out of 10 in intensity, you can now add the head and neck into the movement. So in this case now, I would tilt my head away. And all of a sudden for me, the stretch intensity gets ramped up. And now I'm easily at a 3 out of 10 for intensity. So here is the shape of the body that we need to create for this exercise. And what I'm going to do here now is drive the mobilization from the shoulder. So basically we want to take a joint that the nerve crosses and we want to move that joint to mobilize the nerve while it's under very gentle tension. So I'm back in the position. I feel this stretch around the deltoid area and also radiating up a little bit into my neck. I'm at a 3 out of 10 in intensity, and now what I'm going to have you do is draw really small circles coming from the shoulder joint. So you can kind of imagine like tracing a circle with your elbow, but the joint that's actually moving is the shoulder. And so when I do that, it feels really good. It's a very gentle stretch, and once I add the movement, it gets a little bit more intense. There's no pain, but understand that because we're putting gentle tension on a nerve, sometimes that tension balances the line of what feels good and what might be slightly uncomfortable, but certainly no pain. You don't want to feel pain. If you do feel pain, either terminate the exercise, this isn't for you, or you'll be able to play with and adjust the position to meet your needs. Maybe you were into the position a little bit too deep and you need to back off on any part of the sequence in order to get you to a place where it feels comfortable and not painful, okay? So we just did our first set, okay? And we did those small little circles coming from the shoulder. So we used the shoulder as the driver. Let's do this again. I'll change my angle a little bit, still working on my right arm. So partially bend the elbow, rotate the arm in, take the whole shoulder, shoulder blade included, draw it down, pull the arm back. I'm starting to feel the stretch sensation now, and tilt my head, remember, away, tilt the head away from the target side. Now I've got my 3 out of 10, and I create my circles. Of course, we can go in both directions. And I'm just trying to produce a really clean, really smooth circle. I'm not working at a fast speed. If anything, slow it down if you're not sure. Sometimes people get carried away with the speed. You know, and after about maybe 8 or 10 circles, shake it out a little bit, okay? So you've performed the exercise now, and remember, this was the critical part. You have to immediately reassess to see how your shoulder is responding to the drill. So go back to your initial assessments. If it was a lateral raise, go ahead and test that lateral raise. If it was a shoulder abduction, test that. Rotation, mine have improved a lot, especially my internal rotation and my external rotation actually, so that's good. And I actually just feel more ease of movement, right? I didn't have any shoulder pain going into this demo, but I can just feel that overall, my mobility is a little bit better with my shoulder. Now, I would not know that if I didn't immediately reassess. So that's what's cool. I can now determine that this exercise is very useful for my shoulder and improving mobility. So this is what I want you to do. You have to get a baseline assessment. Then take the time to learn how to do the drill and how to hit the target accurately. And then make sure that once you're done with that set, you immediately reassess just like I did, and you'll be able to determine whether or not this is the right exercise for you. Remember, there are 3 possibilities. You will either get better, and that means your range of motion has improved, and maybe your pain has decreased, and that means it's a high payoff drill for you. You might be the same, meaning there was no change. For whatever reason, your brain and body was not impressed with the exercise. Like I said before, you can give it another try, see if you can tweak something to hit the target a little bit better and more accurately, and then maybe you will get the result that you're hoping for. And then last, if you regress, we're going to call that a threatening exercise. And if you try it again and notice that you're still regressing, then we have to respect that. We have to respect what your brain and your body is telling you. And therefore, we're going to take that exercise, move it aside for now, and we're going to go hunting for something different, a different stimulus that your brain and body might like better for the specific issue that you're dealing with. All right, now I want to teach you one really cool tip that you can apply to this exercise, and it could completely change everything for you. So we're going to get back into the position to tension axillary nerve. So let's review that. Partially bend the elbow, inwardly rotate the arm, take the whole shoulder, drop it down, move the arm back. Maybe you're starting to feel the stretch now. Mine's starting to build up a little bit. Then I take my head and neck, tilt away from the target side. And now I feel that stretch that I'm after. That's a 3 out of 10 in intensity. Remember, do not go higher than a 3 out of 10 in intensity because nerves don't like to be aggressively stretched. We're just looking for a little bit of gentle tension. Now, as you remember, our first choice of driver was the shoulder. So we actually moved the shoulder. We created small circles with the shoulder to drive the nerve mobilization. Here's the cool thing about nerve glides. Once you put tension on the nerve, you can actually drive the mobilization from any nerve that any joint that the nerve crosses. So remember I said this particular nerve originates in the neck at the C5 and C6 level? Well, that means we can actually use your neck to create some mobilization for this nerve. And that can completely change the result for somebody. So I'm in the position, and now instead of shoulder circles, here's what you can do. Take your head and your neck, go forward and backward. Okay, we call these forward and backward glides. Okay, and so I'm literally doing the chicken exercise where I slide my chin forward and then backward, but I keep my chin level like it's on a tabletop. Once we get into position, and even though my head is tilted away, you can see me from the front here, even though my head is tilted away from this target side, I can still slide forward and slide backward. And you'll notice that the level of tension that you feel on the axillary nerve will actually change as you glide. And you might actually feel it build up, okay, a little bit. You might also feel it go down, like reduce. And as I'm doing this, I actually feel that overall the tension is becoming less because I'm starting to feel more mobile as I perform each repetition. Okay, so this variation is something that we often refer to as spinal cord flossing. And this is what's really neat about nerve glides. When you tension any peripheral nerve, so this is the axillary nerve that we're putting under tension, we can look at the joints that the nerve crosses and we can just mobilize from these different areas, and the area that's going to be best for you, meaning the area that gives you the best result, is really based on your brain's needs and also your history, maybe of injury. Okay, so after you try this one, remember what you have to do, the critical part. You have to go back and reassess to see how it feels. And actually, for me, the spinal cord flossing, so moving from the neck, was actually better than moving from the shoulder. So I can feel that I've got more ability, especially to my external rotation feels a lot better, okay? And my internal rotation got a little bit better too. So remember, test your different drivers individually. Do a set driving from the shoulder, test that, see how you do. Maybe that's good for you, awesome. Then move on to the spinal cord flossing variation where you're doing the cervical forward and backward glides, and immediately retest that. I've given you 2 options now, and you can see what your brain and your body prefers. All right, chances are, if you've made it this far into the video, the axillary nerve glide was a high payoff exercise for you. Awesome. I'm super glad that it was helpful. Now we need to talk about what to do moving forward. Everyone always asks me like, okay, that was amazing. How many sets do I do? How many reps do I perform? So let's talk about that. I want to summarize this for you so that you are really clear on what to do. Now, let's say you perform this axillary nerve glide and your shoulder gets a lot better fast, and that can happen, certainly. Your pain goes down, your mobility comes back, everything's good. You might only need to call on this exercise as what we call general threat reduction and practice it a few times a day, maybe 8 to 10 circles or glides if you're doing the spinal cord flossing variation. You might be able to do that a few times in a day, get that threat reduction, and then just return to your day, moving, and find that you're good. And you only have to call on this exercise when maybe you absolutely need it. And then your pain goes away, your function comes back, and you're good to go. Awesome. We like it when it's easy. Another opportunity to practice this particular nerve glide is maybe incorporating it into your warm-ups and your cool-downs with your exercise routine. That's where I really like to do my nerve glides. One of the cool benefits of any nerve mobilization is that they are extremely good for increasing what we call neural drive to the muscles that the nerve supplies. So let's say you're about to do like an upper body kind of routine or something, strength training routine. You know you're going to be doing some shoulder presses, whatever the case. You can actually use the axillary nerve glide to kind of prime your body and get it ready for that strength training. And you will likely note that doing the axillary nerve glide before going into your strength training actually gives you a very dramatic increase in not only the quality of movement that you are producing, but also the strength, which is really cool. Okay, so if that sounds like you, great, have fun with it. I think that this is going to resolve your issue rather fast. Now, for those of you who have a longer standing history related to shoulder problems, it may not be that easy. Perhaps you found that the exercise is high payoff and you're starting to practice it, but now the question is, okay, it's helping me, but what do I do now? Because it's not, my full function hasn't returned and maybe my pain went from a 6 to a 3, but I'm still not fully back yet and ready. Let's start to talk about what you have to do next, because the most common question that I get when I teach people how to use exercises like this, and those exercises dramatically increase people's mobility and decrease their pain, the question always is, okay, my mobility's better, how do I keep it? Because I notice that I do my exercises, my mobility is much better, but then maybe the next day, not so good anymore. And maybe that discomfort is starting to come back. Well, we got to be consistent with the drills for sure. That building on that consistency is going to help you get stickier, as we say, stickier long-term results, meaning the results stick around, okay? But what we also have to consider is providing your body the next training stimulus so that your brain can learn how to own the new range of motion. And actually, most importantly, new range of motion in a new pain-free range of motion. So that's where this comes into play. This is a furniture moving strap. And honestly, you can use anything. You can use a yoga strap, whatever kind of strap you might have for like stretching practices. You can use a rope, you can use a belt, but basically what I'm just very briefly going to show you is how I love to use isometric exercises as a way to create more long-term result for a person once they've used an exercise like the axillary nerve glide to create a result. So very simply, I would take my strap here, and let's say I did a couple sets of axillary nerve glide, so my movement's better, okay, my pain is reduced. Now I would take my strap and I would step on it, okay? And I'm going to find some pain-free ranges of motion, and I'm just going to contract against the strap. And this is what an isometric contraction is. So perhaps I contract here, and maybe I do a 5, 4, 3, 2, 1. Okay, maybe I go out to the side, okay, because this was previously maybe a painful range of motion, and now after doing these nerve glides, it's no longer painful. Okay, so I'm going to contract out there and teach my brain that it is safe to now contract these muscles in that range of motion. Okay, I can even get a little bit more creative and go into some kind of extension-based movements where now I'm lifting up, okay, with my arm and contracting, again, maybe for a 3 count or a 5 count. And we can start to build the range of motion out. So now I'm starting to get into some new ranges of motion and teach my brain and my body how to contract in those positions, okay? This is really, really key. This is something that you would do to start to own the result a little bit better. Rather than just doing the exercise, getting a result, and then walking away, sometimes we need a little bit more integration, okay? And if you had shoulder problems for a while, maybe you are dealing with like weakness and you have to recondition your muscles and the joint. Isometrics are a wonderful way to do that because they are the least threatening form of strength training, okay? The least threatening form of strength training, that's the key takeaway there. So rather than just returning to like the traditional stuff you might be doing in the gym, okay? You might have to back up a little bit, do some gentle isometrics. Now here's how I want you to perform them. I want you to only contract at say 30 to 40% of your maximum intensity. And how do you know if you're at 30 to 40%? I always tell people you need to be able to still breathe very easily while making the contraction. If the contraction itself is laboring your breathing, that means you're contracting too hard right now. You might be able to build up over time to near maximal contractions, and that's great. That's going to help you get stronger. But at first, it's about reducing threat and taking that window of opportunity that you've created by using your high payoff axillary nerve glide, where now your brain has granted you more range of motion, okay, more mobility, and less pain. Take advantage of that window by doing the gentle isometrics and building that out for yourself. Make sure it's low intensity at first. You still want to be able to breathe. Over time, increase the intensity, change the positions, and I think that that's going to be extremely valuable in making your comeback after struggling with a stubborn shoulder issue. All right, that's it. That is the Axillary Nerve Glide, plus a few other variations, and remember, most importantly, a process to go through in order to assess and reassess to discover whether or not this exercise is the right exercise for you. So I really hope this exercise helps you out. Last, if this video was helpful for you, make sure to like this video, subscribe to the channel, and comment on this video. Every single video that I do, I will pick 3 winners, people who have liked, subscribed, and commented. I will pick 3 winners to win a free month in our Strength and Mobility Dojo. So I look forward to hearing from you, and I will see you soon in the next video. Thank you so much for watching.